Well, good afternoon. Unfortunately, what Michelle and I are going to show you this afternoon is not really something we would like to be showing you, but what we have here is our cow Rosebud is dry, but a couple of days ago she came down with mastitis as a dry cow, and that's a pretty unusual situation. And like any other mastitis, especially in lactating cows, you kind of quickly go look for a possible reason why that may have happened. In our case here, with having a gorgeous fall and the barn being clean and dry, we kind of narrowed it down to the fact that this year we had an amazingly bad year for biting flies that caused these bloody little wounds on the belly floor and into the havings of the udder. And no matter how hard we worked on them, they created these irritations, and then the yellow jackets would attack those sites. So that's about the only thing we could come up with that would have done something in this regard, because it's certainly not the season and the environment that would normally cause it. Now, you say, okay, a lactating cow, you're working with her every day, so how did Michelle and I observe and detect that Rosebud had this hard quarter in her right front? And I thought it was kind of interesting. I pulled off our dairy-related magazine books in our library, and here in a book that was written quite some time ago, it kind of just defined it perfectly. It says the symptoms that come with this condition in a dry cow with mastitis is depression of the animal's spirit, which was real obvious to us, kind of a roughening of the coat, hair standing on end because she might have a fever involved with this. Dull eyes, which is obvious. Loss of appetite, and Rosebud is such a phenomenal eater. As you can see, she's even eating the weeds here by the area where we're working on her. And suspended rumination, so you don't see her cutting. And then with that, the big thing that made me get her and start working on her was the constipation, where it was very difficult for her to pass her manure.
Do you want to show the cover? It's kind of cool.
New and a revised edition of Veterinary Guide for Farmers. I was so impressed when I found that, the symptomology of the situation we have here.
So Rosebud did stop eating. Was that the first sign?
I think the dull and listless, her mobility, she wasn't real thrilled about moving and keeping up with the other two cows in the program. So she slowed down, and you had the dull eye, and then you had the dry nose, which goes with it. And the dry nose and the hair coat was indicating that she was probably running at least 104.5 fever. And so we... So
what did you do first to treat it after you found it?
Well, same thing I'm going to do now is I mixed it out as best I could, and you got all this crummy stuff out of there, and you really work at that because you want to get all that out. And so strip and strip and strip and strip into this container that I will throw away when we're done treating her.
Go ahead. By now we're just seeing that mostly liquid.
That's liquid, and what that is that's the antibiotics that I've already put in there are doing their job, and they're you can see the oils in the solution maybe. And that's your penicillin suspended penicillin.
What did you see the first time you milked it out?
Much browner, and the thing that scared me actually a little bit, and the severity of the condition, was it smelled bad.
Like stinky?
Rotten bad. And so that made me get pretty busy.
And is the quarter kind of hard there? It looks like it kind of firmed up.
It's got...
Whereas the other quarters are still soft.
Yeah, the other ones are perfect the way a dry udder ought to be. And the way Mother Nature works, now that we've killed the infection and the antibiotics, there's no heat, she's happy, she's cutting, all those symptoms have pretty much gone away. Mother Nature will, between now and time she does calve in about 5-6 weeks, the quality and texture will come back once you get the fever out of there.
Does some of the edema stay sometimes?
Yeah, we'll probably up in this higher region. You get some cellular damage and
some permanent edema.
Yeah, that hardness will stay there.
Were there chunks in the milk the first time you milked it out?
No, it was just brown, stinky solution.
And it's fluid, not actual milk.
No, it's definitely. And that's what's unique about a dry cow having mastitis. She's not making milk anymore. And she was, very dry. Her udder was collapsed completely.
What did you give her for the first treatment?
Today.
You gave her the mastitis treatment called Today, which is a lactating cow treatment?
Yes, it is.
Why did you do that? Were you not sure about using the dry cow treatment?
No,
or
that's a really good question. I felt like I wanted to go that route because you don't know what kind of a bacteria you're using, so we'll go with lactating tubes to kill the infection, and then we looked up and discovered that we had enough time to use quartermaster dry cow treatment, which we're going to put in today.
So the first time you gave her Today, did you give her anything else?
I gave her Prevail.
Which is a form of Banamine?
Form of Banamine, and that was to change her spirit and increase her appetite and the soreness. You could tell instantly the soreness went away. Pain, yeah.
Okay. And then you treated her a second time with another tube? 4
hours later, which is kind of the recommended thing to do, is get that first treatment and get that poison out of there. So you keep stripping and stripping like I'm doing now.
Did you give her Banamine then?
I gave her...
Or later?
I waited 8 hours and gave her 6 cc's more. So she got 12 all day.
Has she had any more Banamine since then?
No.
And that was yesterday or the day before? It was just yesterday?
That was Monday afternoon and evening.
No, because you got home Monday night. So it was Tuesday. It was just yesterday.
It was all day Tuesday, yeah.
So today, it's been probably, 24 hours since the first treatment, and we're going to put a dry cow treatment in there, and you won't milk her out again. You'll just leave it.
Yep.
And don't worry about the edema because it's going to take time for all that to go away, correct?
Yep. Correct. Okay, now we're going to clean the end of the teat up with an alcohol prep swab. Which
comes with most mastitis tubes when you buy them.
Every tubes will have a packet of these as well. And we will clean off the end of the teat.
So at this point, if all that came out is pretty much the antibiotic that you put in, is that a good sign?
That's a real good sign. Because the initial strippings of yesterday afternoon were toxic enough that your concern in stripping is you don't want any of that stuff reabsorbing back into their blood system and getting into their system.
Which could kill them.
And if I reopened that book and read the next paragraph, it would say that if we didn't get started on this and get pretty aggressive about it, the result is death, because you get that poison in their blood system.
So you don't want to mess around with mastitis.
This is not something you mess with.
Okay, so we take the alcohol swab, and the teat end's already nice and clean. I suppose if it wasn't, you could maybe dip it in iodine just to make sure.
Yeah, but we're being real careful not to bring over the things that we use in the actual milking program. You kind of like to keep them reasonably separate. All right, we're cleaning that.
So what are you cleaning? The teat end?
Teat end. There's the cistern opening right there.
Why is it so important to have that really clean?
Well, when I put this syringe in there, you don't want to introduce any more bacteria in there than...
So you wipe away from it and don't get your fingers on it or anything?
Nope.
All right. Looks good.
Okay, now we're going to reach in this bucket. I've heated this tube in warm water just to make the suspension, the medicine that's in this tube.
Warms the oils up so they flow smoother.
And then it would be more apt to want to go up and work through a greater part of the mammary system. All right.
We're going to hope she's friendly about all this.
Take the cap off.
And can we show what so it's a blunt end cannula is what it's called.
Yep.
And it comes already on there. Good girl, Rosebud. Good girl. Good
just
girl.
cup it in your hand like this. Slide it up in there. Use the palm of your hand. Push it all the way up in there. Then before you pull it out, pinch towards the ends like that.
Okay.
And then start just working it up. If you want to change hands like this, keep pinching, and then you can use this hand. And this is a pretty important part. In fact, if you had some heat liniment, something that would create heat, it wouldn't hurt to spend.
Kind of like those udder creams that are sold that have peppermint and tea tree oil in them.
Anything that would cause a warmth, that would also help with blood circulation and getting this edema down.
And it was amazing, even after the first treatment that you gave Rosebud and that little bit of Banamine, she went right back to eating and drinking, didn't she?
Oh, she did. It was beyond words that once you took the fever out of this quarter and gave her a little Banamine stimulant, how she just almost like instantly got normal. It was, of course, exciting to see.
Now, when she calves, can we drink milk right away?
No, we'll have to keep this milk from this quarter, well, all milk for at least the first 8 milkings.
Okay, so what I did was I went on to the Valley Vet website. You can go on to many different websites, and they have the manufacturer data. Sometimes if you buy a box of tubes, it'll also come with information, and that way you can be sure to know what your withholding period is. So now that she's been treated, we're going to be really careful and not take the first few milkings for human consumption. And depending on what type of mastitis treatment you use, the withholding time can be different.
In fact, we'll also even be careful when we're pulling colostrum to probably just milk this quarter by hand for the first few milkings for the sake of the calf. You know, you just try to be careful if you can with a quarter that's had antibiotics in it.
All right, well, we'll say goodbye to Rosebud. Tell her we love her. She's a good old girl. She's 12, and she's going to be having, well, she's 12 and a half, going to be having her 10th calf. Thank you, Jay and Rosebud.
You're welcome.